Hey, it's Dr. Jeremy Steiner. What if you could diagnose pain, inflammation, or even internal organ dysfunction just by reading the spine? And what if you could treat it instantly using just 4 to 8 needles and some electricity? In this training taken from one of my recent events, I'll walk you through a system I call Spinal Circuitry for diagnosis and treatment, a terrain-based approach to identifying voltage deficiencies at the spinal nerve level and correcting them with precision. You'll learn how to palpate and map deficient segments, when to use Watto-Jajis versus dew points, how to build a 4 or even 8 needle spinal bracket, and how to use electroacupuncture frequencies for different tissue types. Now, if you haven't already, make sure to subscribe to the channel so you never miss new trainings. And don't forget, this is just one part of the full terrain-based spinal electrocircuitry system I teach at the Electroacupuncture Institute. So let's get started. The organs are connected as well to the spine. So the spine is a great place to both diagnose and treat. Okay, let me pull our patient up here. I don't even know what we're treating her for. We're on the spot.
While she's getting ready, can I ask
Yes.
a real quick question?
Yes, good. Well, you need this microphone.
Oh, I do?
Yes. Okay.
As far as the
Stand
research
with me.
that you did,
Yeah.
Do you have the whole piece of research that we can have?
I can send it to you.
That would be great.
It's only 365 pages.
That's okay.
I'll send
In
it
a
to you.
PDF?
What else? Age?
Well, if we had a magic wand and could fix any one problem today, what would it be?
Probably pain-wise, I get a lot of pain kind of on the right side over
Can
my
you show
wrist,
them?
kind of like right in this
There's your
area.
diagnosis.
And
those-
then anxiety. Those are
And
like
anxiety.
the two things. Like, yeah.
Whoa, now we're getting into a little bit much. Just kidding. It's most likely related, right? When I teach a different class, I always link anxiety to the stomach. Those are the nerves going to the stomach. So yeah, I'm separating the sessions into here's spinal bracketing, diagnosis and treatment for pain and inflammation, and here's spinal bracketing, diagnosis and treatment for internal organ conditions. But almost always they line up because you're diagnosing the terrain of that neural level. That same neural level feeds the organ. If they're coming, she's complaining of pain here, that neural level is deficient because she has pain, the voltage decreased, but that neural level also feeds other tissues which lead to other diseases, possibly the stomach leading to anxiety, right? Thank you.
Yeah, also right hip.
And right hip.
Yeah.
Okay,
Kind of.
so can you diagnose that? Oh yeah, I didn't go over it yet, but let me go over it real quick. We can get away with using dermatome charts. We don't even need to specify dermatome, myotome, sclerotome, or enterotome because there's only 1 or 2 levels difference. And the way I show you, you get it. That's why it's a bracket. You're bracketing a group of neural levels. So basically, look at this chart and tell me a diagnosis for her hip pain.
L3, L4, L5.
Dr. Betts says L3, L4, L5. That's a diagnosis, and that diagnosis is right on. I know for a fact she has deficient neural levels, L3, L4, L5. What does that mean? That means those nerves are measurably not having enough electricity. And how long have you had hip pain?
This go around, it's been 3 months.
Okay, she didn't have a mic, but she said 3 months. How about the low back? How long you had low back?
Well, would you call that low back?
Yeah, or mid back, let's say.
That has been going on for about a year.
Okay, a year. And how long have you had anxiety?
Since I had COVID in like December of 2022, it came like
Okay,
after
that's
that.
long enough. Got it. So that's long enough. That's a chronic problem. So I expect to see some blemishes or something along the neural levels that are deficient. We're going to check you out.
Okay.
Let's get you on your side with your back facing this way.
Sure.
And if you notice, I never treat in prone position. And why, I'll tell you later. We just started.
Thank you.
Good. Now, do you like 2 pillows under your head or 1?
No, one's fine.
Okay.
Thank you.
So we got our diagnosis, right? Don't skimp on the diagnosis. Every patient gets a diagnosis. It only takes 10, 20 seconds, and they're paying us big bucks. And you need to diagnose your patient every single time. See the patient with fresh eyes. Oh, maybe their hip pain went away. That's no longer the diagnosis for today's treatment. You treated them yesterday, right? So the diagnosis for hip pain, somebody said L3, L4, L5. Can you put your hand in this position? Put your hand on the back pain. There. It's your where your whole hand is, right? Okay. I'm just counting. So what you're going to want to do is get comfortable feeling spines when you get back to your clinic. And if you do this motion, my fingers fall in grooves. I feel the vertebrae. I'm able to count vertebrae. And you get very good at this the first day. Acupuncturists are usually very good at getting good at this the first day. And because where my fingers are falling is the huatos that I'm asking you all to needle if you're using a lower voltage device. And once you find so what's the diagnosis for this back pain? Can anybody tell me? T10 to L2. Okay, I'll go with that. So now we can create a bracket. So if you're using a lower voltage device, you're going to use 8 needles. If you're using a higher voltage device, only 4. If you're using a higher voltage device, we do channel. If you're using a lower voltage device, you do huatos, twice as many needles. And AJ brought some lower voltage devices because I do want to demo that now. It's not my favorite. I have to do twice as many needles as I normally would, and we're using the carrier frequency setup. So hopefully I can get away with just demoing it 1, maybe 2 treatments this whole week. But the treatments are the same. You're just diagnosing spine, and you're creating a bracket for the deficient nerves. You can stay there. So I have in my head T10 through L2, and I can extend that bracket because her hip is L3, L4, L5. So now I have in my head T10 through S1, let's say. It doesn't have to be exact because remember the electricity is not unidirectional on the nerves, and it's not unidirectional in the fluids like the interstitium. What's the interstitium? So I have an 8 needle bracket in my head, right? I'm going to go 2 vertebrae above. So in my head I said T10, but I'm going to start the bracket 2 vertebrae above T10 and just spread it out down using 8 needles. So here's L4, now L3, L2, L1, T12, T11, T10, T8, or T9, and T8. Do you see how I counted? Nothing changes, right? Now, when voltage decreases, pain comes. That could be Ashi point too. So I know some practitioners, they push on huatos. If it hurts, that's diagnostic also, right? Now, watch how close I stay to the spine. Did you see that? So this is like T8. Most acupuncturists are scared, but I'm super close to the spine because I'm 100% sure that I had the vertebrae in between my 2 fingers. You can say ouch if it hurts. Now, I stuck 1 needle and it's starting to turn pink. What's happening? Now we're changing the terrain of that neural level already. Her immune system is snapped in, dumping histamine and among other things, and cleaning up the environment where that needle is. That's what I mean by results with every needle. We're actually doing something, but we have to have patience to see those results for what the patient is looking for example. Like the beta endorphins take 24 hours. she's going to get off the table with the same beta endorphin level, but over the next 24 hours, it's going to be a lot more beta endorphins in this pain area than right now after the treatment. See how close to the spine? It's just one thumb distance. Stay real close to the spine. All right, what'd you think? Well, if you ever been frustrated by pain that won't respond to local needling or symptoms that don't make sense on the surface, start looking at the spine. The spinal nerves are the map. Learn to read them and your treatment results will change forever. If you found this training helpful, give it a like and drop a comment below. I'd love to hear how spinal circuitry is showing up in your clinic. And if you want to dive deeper in this method, check out electroacupunctureinstitute.com. Thank you for being part of this work. Peace and bliss.